You're a holistic veterinarian at the Healing Place in Crystal River.
Yes, I am.
Good morning.
Good morning.
So today we're going to talk about heart disease in dogs, or it's commonly known as DCM, and grain-free pet foods.
Yes, there was a release about a month ago now from the FDA that put a bit of a scare out to the public that talked about the suggestion of grain-free diets causing a heart disease called dilated cardiomyopathy in our canines. The thought was that these grain-free diets were not providing enough taurine, and we use taurine to make heart muscle. There's a little bit of a misconception there because, number one, our canines can make taurine on their own. It's not an amino acid we need to provide in their diet. There are some breeds of dogs that we find, for whatever reason, they're not making enough taurine for them to properly make their heart muscle. That has no bearing on what's in their diet or not. Secondarily, grains don't contain taurine anyway. So if we were providing taurine in their diet, we needed to look at what kind of muscle meat was in their diet, because that's where we would naturally get taurine.
So this isn't a disease in certain breeds of dogs, it's actually appearing in a lot of breeds of dogs?
Historically, we have found certain breeds that it is occurring more commonly in. So the boxers, the Doberman pinschers, these are breeds that for whatever reason we are seeing it more, those breeds more represented when we diagnose this disease. But certainly any dog can get this disease, and many other dog breeds have been found to have this disease.
So let's talk for just a little bit about the FDA report that they released. How many dogs were actually in this observation? Is observation the right word?
Right. This was the University of California, Davis Veterinary College, where, like many of the veterinary colleges, they get referred the more difficult cases from surrounding veterinarians. And so they just happened to note that during a period of time, they saw 4 dogs that were not of the breeds we classically saw represented in this disease that had this disease, and that those dogs also were found to have a low taurine level when they tested their blood taurine levels, and that those dogs were coincidentally fed some type of grain-free diet. University of California, Davis did not at that point reach out and say this is what's causing it. They simply said, we found these 4 dogs. In past times we have not seen this number of dogs, even though it's a small number, having this disease. This might bear studying. They also noted in their report that 3 other dogs, again not of the common breeds, were found to have DCM but had normal taurine levels. They also, in that same period of time, had 3 dogs that had tested low taurine that had normal heart conditions. So they simply said, here was an observation, as you mentioned, and it needs to be studied more.
So there weren't any true conclusions drawn, or were there?
Absolutely not. And even to this day, we do not have known causes for dilated cardiomyopathy. It is simply something that happens, and we don't understand why.
So this was a small number of dogs versus, how many dogs do we have in society these days?
About 90 million. So again, to say statistically that 4 dogs that were reported to see this in 90 million dogs is in no way relevant to be able to say statistically it can say anything about this disease in dogs.
So let's talk a little bit about what pet owners should be feeding their pets.
I primarily look at, yes, not recommending a grain-free diet, but I do want pets to be fed foods that don't have wheat, corn, and soy. I don't care about the rice or the oatmeal being in the diet, but I do want the dogs, and cats for that matter, to not be fed diets that have wheat, corn, and soy in them. But more importantly, I want at least the first 2 ingredients on that list to be the meat. Again, we're getting most of our proteins and amino acids and things we use to build the body from the meat components, not necessarily from the plant components. Your dog is a 70% carnivore, your cat's a 100% obligate carnivore. Most of their nutrition would be coming from the meat.
So what about canine breeding practices now in this country, in the U.S.? Does it have a negative effect? Is it having a negative effect on the health of our pets?
I think in general it is, and that's probably going to be the more realistic outcome of this research is that we are, as we humans are choosing, we want this hair coat, this shape of body, this shape of head, and we're breeding for that, we are carrying with it other non-obvious genetic components to it. And so it's much more realistic that we bred the Dobermans, we bred the Boxers, we interbred them, and therefore they became overrepresented in having this heart condition, which you can't tell is happening until they're, you know, up in years and having it. That's more than likely what's happening in these retrievers and other dogs that we're seeing, is we're genetically carrying this disease into it with our breeding practices.
What about lab testing? So sometimes as pet owners we feel like we just don't even know what's going on with our pets or how even to check, but there are ways for us to check, is that correct?
Certainly with the taurine level, they can do a simple blood test, send it off to the common national laboratories, and check for how much taurine is in my dog's bloodstream. It's usually $200 to $300. So is that a necessary test? I would really refer back to your veterinarian. There are some other tests that just indicate heart stress and things of that nature. Of course, the gold standard is an ultrasound of the heart, and that actually lets the veterinarian look at the actual dimensions of the heart. So certainly a blood taurine level is done. Is it commonly done in the conventional practices? Not at the veterinary level, where your general neighborhood veterinarian is. Usually by the time they've been referred to the larger research universities is where they're doing those types of tests.
What about supplements?
We certainly want to look at, if we've got dogs that are the Boxers, that are the Dobermans, or that's your dog that via an ultrasound or something else has already indicated that there are some heart problems, certainly looking at Standard Process makes one called Canine Whole Body. There are others out there. Or if your dog has been tested to be low in taurine, whether you choose to work with your veterinarian and do a taurine supplement for your pet, or whether you choose to make sure that that pet food has adequate meat muscle in it so that the dog is consuming adequate levels of taurine.
All right, so nutrition, metabolism, they're complicated issues. Where does this leave us?
It really doesn't leave us anywhere than where we were a month ago. We are still going to recommend the best we can as far as nutrition. Yes, my holistic approach vastly differs from what you're getting fed at your conventional veterinarian office as far as nutritional things, but yes, we want the best nutrition. Yes, we want to do the best we can genetically. If we've got any questions, again, the symptoms that your dog may have a heart problem would be congestive heart failure, where they're suddenly coughing more, they can't catch their breath, they're having to work more difficultly to breathe, and at that point veterinarian might hear a heart murmur, might hear some fluid in the lungs, things of that nature, and would at that point recommend doing an ultrasound. Certainly if you've got some of these dogs breeds that absolutely are prone to this, preemptively doing an ultrasound to see what is the shape and condition of that heart, more so than what your doctor can hear or what an x-ray can show, is your optimal healthcare options for that dog's. And yes, preventatively looking at using something like your canine cardiac support or others to simply say, I want to preventatively make sure my dog's getting enough taurine because they are of the breed that may have some issues.
Thank you so much for helping us keep our dogs healthy and for providing us with a lot of the training and things that we need that are hard to find. And you offer lots of training here at the Healing Place also. Tell me a little bit about that.
Well, we usually at least once a month do various continuing education courses to be able to reach more nationally. We are starting to record those, and so we have a membership program where they can go in and for a small fee be able to see the recording of our various lectures that we provide to our clients here, and we'll be expanding that as the years go on.
Thank you so much.
You're welcome. Thank you.